Well, hello everybody. I hope there are some of my clients that have found me. We're going to answer some questions about Medicare, and I'm constantly getting calls about how do I sign up. I'm going to be turning 65 soon. So I've been in this business for 15 years, and I have helped thousands of people with Medicare over the 15 years. And there are specific times when you want to sign up for, your Medicare, whether it's um, just signing up for Medicare or whether it's drawing your benefits as well. And there are certain forms you might need, and we can share those here um, on our screen. So if anybody is live with us and watching us today, do you have any specific questions um, that you need answered? I'm here to answer those questions. So, since I haven't heard from anybody yet, I just want to share a couple of things. When you're signing up for Medicare, you're going to need this form. It's on the Social Security website, or you can contact us or come into our office and we will be glad to supply this form. It's called a CMS 40B, and you will need this to sign up for your Part B benefits. And you have to have Part B in order to be able to see doctors, right? And let me just minimize that. I want to show you another overview. The ABCs of Medicare. A and B are what we call original Medicare. A covers hospitalization and skilled nursing. B covers your physician services, outpatient testing, durable medical equipment, even outpatient surgeries, home health care, things of this nature are covered under B. We use a lot of things in B. We aren't always in and out of the hospital or going to skilled nursing, which is covered by Part A. So, really important to have B. And there are two different ways to have prescription drug coverage, either Part C, Medicare Advantage, or Part D, prescription drug coverage by itself. And so the Medicare Advantage does give us some extra benefits for dental, vision, hearing, and some over-the-counter benefits sometimes some other benefits depending upon maybe the level of chronic condition or um, your income. You may be eligible for help with food and the like. So, if anybody has any questions about those things, please go ahead and post now. And I see Sarah has asked, is there a penalty if I don't get signed up before 65? So, this is a great question, guys. You want to get signed up for your Medicare by age 65. I would contact Social Security's office to let them know you want Part B. You will get A at no cost if you worked at least 40 quarters. And then you have to tell them you want Part B. Now, if you're already drawing Social Security benefits, and you can draw as early as age 62, as we know, if you're already drawing benefits, you're likely to get a Medicare card in the mail prior to your 65th birthday. But if you're, let's say you're still working and you weren't even thinking about signing up for Medicare, you want to sit down with an agent like myself to determine whether you want to stay in your employer insurance coverage or whether you want to go in Medicare. Medicare can be set up so you have little or no deductibles. Okay? Um, so What can we be penalized for out of all that? If you sign up late for Part B, if you don't have other credible coverage, guys, uh, that covers as well as Medicare's medical coverage in Part B, you sign up down the road a year, 2 years later. If that coverage wasn't credible, then you will pay a 10% penalty on your Part B benefits. Currently, Part B costs $202.90 each month. They take that out of your Social Security check, or they will bill you for that if you're still working and you don't want to pay for that um, through a Social Security check or don't have a Social Security check yet. Then let's talk about drug coverage. The other thing you could be penalized for would be not having credible drug coverage. So I've unfortunately run into people that said, well, I didn't need drug coverage. I've got drug coverage through my employer. But their employer's drug coverage may not cover as well as Medicare. Medicare's drug coverage has got much better in these last couple of years where they've taken the donut hole away. And so you will pay 1% of the national average premium for drug coverage for every month that you delay signing up. So I hope that answers that question. Any other questions? Someone posted a question. How long have you been in the insurance industry? It's a great question. So back in the 80s, I was actually billing insurance. That is a different side of the insurance industry. I worked for a cardiac surgeon. I even did surgery scheduling. All of that I did not realize was preparing me for this part of the career in insurance that I've chosen. 15 years ago, I started selling insurance. Um, and I love what I do. I see it as just helping people and um, just thrive on helping people save money and understand. I help educate people so that they understand their Medicare better. If you are more educated about how Medicare works, you're in a better place to make good decisions for yourself. Anybody else have a question? If not, what I want to do is take a minute to talk about the Part B coverages. Um, in 2026, Medicare Part B costs $202.90. I hope you can see this screen. Um, there are some circumstances, and this question comes up a lot with my clients. I can't afford that. That's why I delayed signing up for Part B. Well, we might be able to get you help paying the Part B premium based on your income and resources. There is something called the Medicare Savings Program, and those applications are processed by social services, and we'd be more than glad to help you review the guidelines for, you know, help with the Medicare Savings Program and or even full Medicaid. So I wanted to speak on prescriptions a little bit. Oh, Candace is asking, where can I get Medicare forms? If you'll contact us, um, I will email them to you or go to the Social Security Administration site. Make sure you do ssa.gov, G-O-V. Do not accidentally put ssa.com because that's a fraudulent site. So very important you do .gov anytime with any government sites. And you want to search in the search bar at the top of the Social Security website for 40B, or click on Medicare in the band at the top of the page, and there's a place where you can sign up for Medicare. It's a drop down, and it may require you to sign in with a login that you have for the Social Security site. But if you want to contact us direct, I'll have my girl post our email direct to me, and I'll be glad to send the forms to you. We'll wait a moment to see if anybody else has a question. And then I want to take a minute to talk about prescription drug coverage. There are so many people that call me about why am I having to pay for prescriptions this year? In the past, maybe they didn't have to pay for prescriptions. So there's been a lot of confusion with this year. Um, if you got extra help paying for your prescriptions, it's a program based on income and resources. It's called Extra Help. That's deemed by Social Security. If you're getting that, there were plans in years past that maybe paid all of your prescription costs for you. So you just took for granted that you got all your prescriptions for zero cost. Well, let's talk about that in more depth. There was actually a copay for those prescriptions. The insurance company elected to take some of the monies they got from Medicare to help pay for your insurance. They took those monies and decided to say, hey, let's go ahead and cover these copays for the folks that get extra help. In 2026, we're seeing where they don't have enough money in their reimbursement from Medicare to help pay for your insurance to give them the freedom to feel comfortable to pay every one of those copays. So many of your plans may have tier 1 drugs may be zero cost, or even tier 2 drugs might be a zero cost. However, some companies are charging you $5.10 if you have extra help, because that was the copay they picked up in the past. That was the generic copay. And then there's a different copay for brand name drugs. That's $12.65. And there's so much confusion about, well, how, am I going to have to pay this all year long? When 25% of the retail cost of your drug coverage between you and your insurance company hits $2,100, you will then not have to pay any more. You'll be at catastrophic. You won't have to pay any more copays. And that's a lot that I just told you right there. But what I would like to do is meet with people one-on-one. That's what I've done for 15 years. I think we understand what we hear from somebody sitting across the table from us. And we see people here in the office, and I drive many, many miles every year to go and meet with people at their homes or at a public place. And I go over all these things. I hope that was understandable. Does anybody have questions about supplements and not just Medicare Advantage? Supplements aren't as common. They're called a Medigap policy. And that's the other way to do our Medicare. When you have a Medigap policy, that's when you need to couple your supplement with a standalone prescription drug plan. And there are upsides to that, there are pros, and then there are cons. So with a supplement, you can go to anybody in the country that takes Medicare, don't have to make sure they're in any network, and this kind of thing. The drug coverage downside to that is almost all plans have a significant Part D prescription deductible. And that has really frustrated a lot of people. But it would take a little bit more time to go into detail about all the supplement plans that we have. But we do everything here as senior insurance professionals. And I've gotten a text message from another individual. Howard is asking, how do I qualify for the extra help? All these people claim they're getting on a card. Okay. When you talk about cards, we're probably talking about extra benefit cards. And these cards are based on income and resources. Let me see if I can bring up and share a document with you. Um, I don't have it at my fingertips. I'm embarrassed. But there are income and resource limits um, for the extra help, and then also for the Medicare Savings Program. It is especially so when you're in the Medicare Savings Program. This means the state you live in is paying your Part B Medicare premium. There are different levels and may include full Medicaid. Okay? When you have full Medicaid, and I think Howard is in Virginia, there is a waiver program. There may be lower levels of Medicaid. They may have full cost sharing. So that means if you have full cost sharing, Medicaid in your state is picking up all the out of pocket expense after Medicare, right? And if you're in a Medicare Advantage plan specialized for dual, meaning federal and state, right? Um, you have extra benefits. And one of those is a card. Many of these cards let you buy healthy food, might help you pay utilities, your choice. I've known some cards to help people with transportation where they could just um, order an Uber and pay for it with a card. And this is very helpful because many of the plans don't supply them with transportation help. This is a real problem for folks that aren't driving anymore. And so these extra benefit cards really come in handy. It would be worth a one-on-one review, Howard, to see what level of Medicaid a person has and what level, the most robust card that might be available to them. Does anybody else have any more questions? Well, with that, our time is just about up here. I've been on longer than I thought. I hope this was informative, and we're planning to do this again in the future. And for right now, God bless. And if you need us, oh, I see here, Anna, when does senior insurance professionals help with other insurance besides Medicare? We do life insurance, dental, cancer. Um, I hope that helps answer that question. Let me see if anybody else is on. All right, with that, I'm going to sign off, and we'll post our next live video in a week or two. Talk to you soon. Bye bye. Okay.